I am very pleased to welcome in our first segment of the show today Karen Laganelli, who was named in June as the new CEO of Notre Dame Healthcare, which has been in this community for a long time. Welcome, Karen.
Thank you, Tim. It's a pleasure to be here this morning.
And while you have a new position, you're not necessarily new to the Central Mass area.
Oh, God, no. I've spent my entire professional career working in the Worcester area in several different healthcare organizations primarily, as well as a local legacy nonprofit organization, Family Services up on Harvard Street. So I've essentially spent my whole career in the city of Worcester.
And your background as well, a bachelor's degree from UMass Amherst, and your master's in healthcare administration from Clark University.
Yes.
And that being said, we'll make a little plug. We're very excited for our Chamber annual meeting, the 140th annual meeting of the Worcester Regional Chamber of Commerce. We're going to have the new president of the UMass system, Marty Meehan, speak. And certainly, I think for the 260,000 UMass system alums in the Commonwealth, to have one of their own now leading the organization is a big deal.
It's about time, I would say.
It is. But Karen, you've been in this field, taking over a new organization. Why don't you tell us a little bit about the Sisters of Notre Dame, the healthcare system that it's grown into?
Thank you. I'd love the opportunity to do that. Notre Dame Healthcare was originated just over 20 years ago by the Order of the Sisters of Notre Dame de Namur. The order had a convent building on Plantation Street since the turn of the 20th century and operated its own infirmary. But about 21 years ago, they constructed a long-term care facility, which has been in operations ever since.
State of the art.
State of the art, considered one of the top-shelf premier facilities in the city of Worcester and the Commonwealth of Mass. Carries all the quality credentials at the top of the spectrum. 5-star from CMS, perfect scores with the Department of Public Health, report card scoring system in the Commonwealth as well. About 15 years ago, looking around and perceiving more need, the order went forward and renovated the convent building into assisted living. Right. And both buildings house people from the general community, but also sisters of the order who are no longer able to care for themselves and need to be cared for by a team of professional health care providers. Pursuant to opening the assisted living, about 8 or 9 years ago, the order opened a licensed Medicare hospice. And that hospice has grown considerably over the years. We serve people both in the assisted living and the long-term care facility that we operate, but also about 20 other facilities, rest homes and skilled nursing facilities in the region, and then individuals in the community. In addition, we have been operating under a contract with the Commonwealth of Mass for a pediatric palliative care program, which is one of 7 in the Commonwealth, and we are operating the largest one.
And so in that regard, oftentimes people think of assisted living and hospice care, people towards the end of the life spectrum. On this end of it, you're working with children.
With children, right. And children with potentially life-ending illnesses is the population that program is serving, building on the skills and strengths of our hospice program. We also provide a private care management service, Affinity at Home. We operate an educational bridge center because the order has 2 missions. One, to provide care and comfort and charity through the delivery of healthcare services. But in addition, the Sisters of Notre Dame operate many educational institutions, one right in Worcester, Notre Dame Academy.
Yes, yeah.
And so consistent with that premise of the order, we also have an educational training center, and many of the sisters and residents, both in the skilled nursing facility and assisted living, actually still tutor.
Right.
And they are involved in project work, helping new citizens, actually. Immigrants become citizens, and the order covers the cost of the exam and all the training. Wow, because it's part of their commitment to the community.
That's great. And I think just, you described Plantation. Anyone who's driven on kind of 290 Plantation, a distinctive building, the old convent with the new facility, and really a campus. It's just a beautiful setting.
It is. It's a 22-acre property, and the healthcare center operates on 5 to 6 acres within the 22. But as you drive down that driveway, you really just transcend into this very tranquil, peaceful property that really sort of soothes and takes you away. It doesn't feel like you're in the midst of the city, if you will, right off the edge of 290.
Yeah, next to Green Hill Park.
Yes.
You talked about the credentialing and kind of the accountability and the merits and the positive evaluations that Notre Dame has received. Healthcare, is, you know better than I do, has changed, the needs, the training for employees. How many employees?
We have 360 employees right now working with us, which is quite a number. It must make us one of the larger non-hospital system healthcare providers from an employment perspective, and we're still growing. We've been awarded a grant from CMS, Medicare, Medicaid Services, which will allow us to initiate an adult palliative care program effective 1/1/2018. So we're gearing up for that. We're in discussions with other organizations around the community about partnering and collaborating, and we were awarded one of the coveted positions with the UMass ACO. We're one of 9 local skilled nursing facility providers who were selected to participate in that as well. So all of this means a continued change in the organization to adapt to the trends that are prevailing in healthcare right now.
Accountable care organizations.
Yes, ACO's accountable care organizations.
And collaboration are really the new realm, coin of the realm, right?
They are. Under the most recent healthcare reform bill passed by the Commonwealth in 2012, the state is interested in promoting care in a different way than has previously been provided, and Notre Dame is very interested in staying at the forefront of that change.
And as a great chamber member business, we're very interested in your continued success. And Karen, wish you the best of luck as you begin this new track in your career. And thanks for joining us here on the show.
Thank you very much, Tim, and much success to the chamber as well.
Well, we're going to keep plugging. We'll be successful as long as our members are successful. And we want to have you come back. We're going to talk with Troy Siebels from the Hanover Theater. Following that, Troy will also join us with Danielle Shabo to talk about the transformation from the Woo card to the Woo Pass. Stay with us, and we'll be right back.